It is with great pleasure that I welcome my friend and colleague, co-regent, Dr. B.J. Hancock from Winnipeg, Manitoba, to From the Frontline, Surgeons' Voices for the ACS Bulletin Brief. Welcome, B.J.
Thank you very much, Steve.
Pleased that you could take the time to be with us, Dr. Hancock. You've certainly put a lot of time and effort into the program committee, and we're all appreciative of your labors, your wisdom, and your insights to put together a great program. If you could please just share with us some of the aspects of the program that you think are going to be particularly salient to general surgeons and within that group to trauma critical care surgeons.
Thank you very much, Steve. I think there's always been a very solid educational content to the clinical congress for all general surgeons and trauma surgeons. I think with the program committee, we've made substantial efforts to make sure that there's something for everybody. And we make great efforts to make sure that there is solid educational content in each subspecialty area. Where it really started to come together, I think, was when Dr. Valerie Ruch was chair of the program committee, and she and the team really created a taxonomy. And Henri Ford, who's now the current chair, has continued to use the taxonomy. We've been perfecting it a little bit and making some changes to it, but it has really ensured that the content and the knowledge that that participants get out of clinical congress is valuable for everyone who's able to come, whether you're in a general surgery, whether you're trauma surgery, or any of the subspecialties of surgery, that there's something for everybody.
Thank you. Your specialty is pediatric surgery, pediatric critical care, but you're certainly attuned to what's going on in other elements like adult critical care. Do you think you could perhaps name a couple of sessions and or speakers that might be of interest to surgeons within that realm?
I know a number of the surgeons really make an effort to go to the Scudder oration for trauma, and all of the sort of named lectures that are to do with general surgery, as well as a lot of the general components where we'll have panel sessions on gallbladder disease, pancreatic disease, hepatobiliary areas, even thoracics. A number of general surgeons even still do some thoracic surgery. And so I think there's, as I mentioned, there's something for everybody. And I think the content has been spread over a number of days to try and ensure that you can optimize what you can experience at the Congress. So I think, again, it's there's no content that's really not worth seeing.
For your specialty, pediatric surgery and pediatric critical care, you're going to a Congress which is overwhelmingly represented by surgeons who take care of adult patients. What are some advantages you find going to the annual clinical Congress as compared to one of the Pediatric Surgical Society meetings?
Well, that's a good question. Certainly when you go to your specialty societies, like I go to the Canadian Association of Pediatric Surgeons annual meeting, I go occasionally to APSA, and the content that's at and there's the AEP as well. The content that's at Clinical Congress has really been screened and recommended by the Advisory Council for Pediatric Surgery. And the program committee made sort of a policy a few years ago that the specialty advisory councils and the specialty areas could dictate what goes on to the program a bit. They're very involved in what's chosen and the content that goes in there. And they're trying to balance that content to the content that's actually within the same year, the AAP and APSA, so that there's no overlap and duplication. So when there's folks that want to go to as many meetings as they can, they know that at the Clinical Congress they can get some part of knowledge that are pediatric surgical sessions that will be different from what they've been at other meetings. The other thing that's really, I guess, quite valuable as well is that you get, at the Clinical Congress, you get some of the things that you would never be able to receive at your specialty committees. They're just not able to deliver a lot of those areas. There's things like ethics and sort of legal things and some of the skill courses that, well, of course, we won't be delivering that this year, but those are areas and content that you can't get at a specialty annual meeting.
Thanks very much, Dr. Hancock. Now, you mentioned going to meetings, which of course nobody's doing at the present time other than the way we're doing it today, sitting in our respective offices and our homes, speaking with each other. How do you think the virtual Congress and the price of the virtual Congress being free will impact Canadian surgeons?
In the experience we've had so far with other activities that have turned to a virtual nature is that the attendance has escalated. Sort of the Safety and Quality Conference for the American College, they found that it was like there will be a huge number of people. I think the Canadians will definitely I think the attendance from the Canadian population will go up because they can reach it virtually. The program committee has done an amazing job of trying to, in a very short period of time, try to change everything so that it could be delivered, the same content can be delivered virtually. It'll remain to be seen how effective that will be, but they've done a tremendous amount of work. They'll be counting on all the participants to meet the demand that they deliver their content according to the recommendations of the vendors, and that they submit all of their materials and presentations either early or on time so that there's time to be able to make any amendments that need to be made. But I'm very confident that they've done the groundwork to deliver an outstanding virtual clinical congress this year, and I think it will be very much a success.
I'm sure it will, and I would point out that the they is you and includes you as a member of the program committee, and I know that the program committee under normal circumstances puts in a countless number of hours ensuring that we have a high quality program, but this year I'm sure was one or more orders of magnitude greater to scramble and quickly convert it into a virtual meeting. A lot of thought, a lot of effort, vision, and talent went into that conversion. Do you think that as we revert to in-person meetings, hopefully for 2021, some elements of the virtual meeting will remain embedded in the program?
I really hope so. I think it's, I hope it's a winner, because I think that going forward, increasingly I see every year, and when I get to network with people that I know and other surgeons, is that they're having a more difficult time all the time being able to go to the meetings that they want to go to. It's hard to get away from home. The expenses of traveling are escalating. Traveling isn't very much fun anymore, and it's not just COVID. This started to happen before COVID really radically changed how we do things. So I think, I hope that the virtual component of it, I think that the in-person component is extraordinarily valuable, and I think there's no question that we have to go back to in-person meetings. There's so much to be accomplished with all of that. But I think that we'll look at the virtual component of it and realize that there are a number of folks who are going to take advantage of being able to participate and being able to spread it out and access the same sessions at different times of your day, over the weekend, the evening, middle of the night if you want to. That's going to be really valuable. And I think we just need to deliver the content, and people will take advantage.
Thanks very much once again, BJ. I really appreciate your time today, as well as the countless hours you've put into creating what I'm anticipating will be an absolutely first-rate program.
Thank you very much, Steve. It was a pleasure talking with you today.